Good afternoon. My name is Ray Kuhl. I want to welcome each of you who've joined for today's webinar. I want to thank you for your partnership with the Academy of Medicine and want to express the appreciation we have for the Academy who's sponsoring this series of webinars. Today's topic is phone system advances applied to patient satisfaction. So the goal of today is to inform and educate, not to sell products and services. So PBSI provides telecommunications products and services, but it's through that experience that we've gained over a number of years in working with hundreds of offices where we've seen what works and what doesn't. And from that knowledge, we hope to share today to help you improve or evaluate the voicemail and communication process you have in place in the practice. So welcome. We're going to begin. So today, this webinar will be very brief. The topic is important, but it's not lengthy. We're going to discuss what do we see as common mistakes and frustrations. And each of us, including everybody who's listening today, has experience in calling voicemail systems or calling practices that seem like voicemail systems and end up with frustration. So what are some of the things we see and how can we avoid those? What are the principles that we try and follow in guiding voicemail design? What are some of the key goals? And specifically, what are some examples of effective and ineffective daytime and nighttime call routing choices, and some other considerations. So again, on behalf of the Cincinnati Academy of Medicine and our partnership with them, I want to thank you for your attendance. Some of you, thank you very much, have been PBSI clients for many, many years, and your longstanding relationship with PBSI is very, very much appreciated. For many of you in attendance today, this is your first exposure to PBSI. So we provide technology services, including telecommunication services, to healthcare practices and other organizations all over Ohio, Kentucky, and Indiana. Cincinnati is our home base, so the greater Cincinnati area, and hence our relationship with the Academy of Medicine here is central to PBSI's ongoing business. We are a Cincinnati company. We support local healthcare organizations. So we have lots and lots of experienced people, which is the key to providing effective support. But it's really from that experience that we speak today, the things we've learned from these years of helping other medical practices. So, you know a little bit about PBSI. What do we see as we experience working with offices to try and evaluate and improve voicemail? The idea about voicemail is that it's the gateway to the practice, and so frequently we don't think of it in that way. The delegation of whoever's assigned the process of setting up voicemail isn't thinking at the same level, possibly. This is not always true, of course, in the same way that the highest level of the organization would think. So some things we see: after hours callers, frequently frustration, delays, slow communications back to the patient. I'm not hearing anything. I don't know what's going on. So that's one of the common things. So too many rings before answer. This is a setting in most systems where you can cause it to ring 7 times before the phone's picked up, which is too many, too long, and so forth. Callers put on hold indefinitely with no communication. Dead air while I'm on hold as opposed to music or messaging. Auto attendant messages that are long, complex, or confusing. We've all experienced these. And that includes the rate of speech of the speaker who's doing the announcing. It can be too fast and it can be too slow. Auto attendants that aren't correctly programmed, where I make a choice and it results in dead air, or I have to call back and we think, who's in charge at this organization? This voicemail is not working and nobody knows this. Many practices express the fear that voicemail boxes are set up but they're never listened to, and we don't know which voicemail messages are set up and really go nowhere. We see on-call providers losing confidentiality of private and mobile phone numbers because the infrastructure to make return phone calls has no choice but to come from the provider's mobile, and it either says blocked caller, which some people don't like, or it actually displays the mobile number of the on-call provider, and there are solutions. So the result is, in a worst case scenario, a patient says, I don't like this practice just because I don't like their phone system, and I feel like that is the, quote, people in this practice. And we want actually the opposite reaction. So what are some goals? We're thinking about improving patient experience and retention. We want people to, quote, like our practice just because they feel like we've really done a good job paying attention to their needs with our voicemail setup. We want to improve staff efficiency, which means rings going to the proper phones with a minimum of putting patients on hold and having phones on hold. And a well-designed system can avoid voicemail messages, reduce certainly voicemail messages and hold time. So important consideration. Provider privacy, as I mentioned, we want to protect the mobile caller ID and home caller ID of on-call providers, and reducing frustrations among providers, staff, and patients. So it's not just patients who get frustrated. Our own staff feels the same way many times, and we just don't understand and deal with this. So our goal is positive impression just by hearing the way our voicemail is set up. So some of the principles that we start with is what are the most important calls we receive and what's the highest frequency of calls we receive. Those are the things that should be at the top of our voicemail choices. Consider who are we serving in priority sequence. So is it patients, referring sources, other clinical caregivers, others? Are there others that might be on your list as a practice? And we're going to talk about considering separate phone number in some cases, which is a recommended solution for referring sources in particular. So we want short prompts on the first menu. We want to limit the total listen time for all prompts to no more than 15 or 20 seconds. So if we start with a message that says, you can find our website, blah, 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 with a long message before we even get to the first prompt, that's likely to be an immediate frustration for anybody who's listening to that message. So submenus are a better choice than a long initial menu, and just think from a caller's point of view. Some of these are very straightforward. The point is, many of us are in organizations, and some of you may be shaking your head yes, where we know that it just hasn't been paid attention to. If whoever it is who's responsible for the phone system within the practice had really a clear understanding of what's going on with their voicemail system, they would do it differently. And so part of this process is identifying, hey, there is a way to fix and improve our voicemail. So what's a typical sequence? There are all kinds of factors that will make this different, but to schedule or change an appointment, press 1. To speak with a nurse or obtain lab results, for prescription refills, for billing inquiries, and if you know your party's extension or for more information, going to a submenu. So, of course, you may want to put at the front, if this is a medical emergency, call 911. Of course, that's frequent. And one pointedly missing item on this menu, which, again, it's a practice choice, there is nothing on this menu that says if you're a doctor's office or hospital, press this. So, of course, you could add that to the menu, but a recommendation we make, since direct DID numbers, direct numbers are not costly, generally you get a block of DID numbers so you can have direct numbers that are free, give that number to referring offices and hospitals, and your Academy of Medicine listing would be your direct number for incoming doctors, and simply avoid them going through this same process. Have a separate menu for other providers. So different ideas to consider, and there's not just one right choice for everybody. So nighttime after hours call routing. So when I asked Tim Latham, who's my partner and the authority, having worked with so many practices on call routing issues, his clear answer was the single most important problem we see is answering services and the way they're handled and how they're set up, and taking a whole look at nighttime and after hours call routing is typically very important. So number one complaint, answering services, which doesn't mean answering services can't be a good idea or that there aren't good answering services. But typically a traditional answering service complaints we see is a message is taken, contact is made to the provider, request for the provider to contact the patient. The whole process has lots of manual intervention and is rife with opportunities for delays. So the patient, as a result, doesn't get a call back as quickly as they might expect or like, and the provider doesn't have the information they'd like to have from the patient because they don't have the context that would have received from a voicemail. So patient feels disconnected when the phone is answered by, this is the answering service, this is The night message, well, how much information am I going to want to give as a patient to the night message? And so the provider consequently doesn't know some of the details that might be really important, and they don't know because of that context missing, they don't know that it's critical or it's not critical. They don't have the information to decide the critical nature of the return call. So sometimes the return call to the patient is delayed by use of old technology, and because of the loss of context, it can impact care quality. So these aren't universal issues, they're just common issues. And typically in answering service, a practice will spend $100 to $300 or more per month, and there are technology alternatives that basically are free or nearly free. You pay a small upfront fee to put voicemail in place and then eliminate the ongoing cost. So what are some of the things we see with effective voicemail technology for after-hours calling? Calls can be auto-routed to the correct on-call physician. So the system can know who's on call, and we tell the system who's on call, and therefore we're not manually intervening and forwarding to the on-call physician. By the system, I mean programming in the telephone system, which can be set to be input by the end user. So when the schedule changes, you tell the phone system and calls are routed automatically. So depending on the technology used, voicemails can be converted to emails. So voicemails can be routed automatically to the mobile of a provider on call, but they can also be sent to email and/or with the voicemail as an attachment. So it can also be texted to providers. So the process generally can be much faster to reach the provider, and then the provider gets the context that they need. And because many mobile phones today, an iPhone or Android, have the ability to auto-transcribe, instead of having to listen to that voicemail message, we click on voicemail message on our phone, and we actually see the text of what the patient's saying without having to take the time to listen to the full message. So another key, we're going to protect the provider privacy, because properly set up, the mobile phone number of the provider can be set that when the call is returned to the patient, it's being routed through the office system, and so the caller ID is our medical practice name instead of blocked caller or the provider's mobile number. So the patient receives an improved experience and aren't frustrated with, oh, the doctor doesn't want me to know his number, so he's blocking the call ID. And of course, we can reduce costs. So looking at after-hours service and how we handle that call routing can really be an important thing to patient satisfaction, patient retention, and productivity of the staff. So other considerations, the idea of what happens when I'm on hold, and am I given options where I can hear customized content or music or information about the practice that might be varied over time. So it's allergy season, get your flu shots now, schedule your sports physical early. Obviously, depending on specialty, what's the kind of message that you might want to vary from time to time that will really help reduce overbooking at certain times and help to spread out workload over a period of time. It can have practical operational benefits to the practice to have this messaging in place. So it's another efficient way to provide information that isn't front and center: locations, hours, directions, website information, etc. Seasonal messages. Happy holidays. You know, it's snow season. We'll notify you by text if there's a snow emergency affecting your appointment, and so forth. Basically, if you consider this, usually these are not expensive. There are no such thing as license-free music on hold, because licensing is a law, but there are very, very inexpensive licensing arrangements that are specifically designated for this kind of environment. So you can be completely above board and ethical at a very low cost. So considering how this is implemented or not is something that's typically important to do. So we have concluded content today. Hopefully you find this information helpful. It's just a good thing to periodically step back and ask, what message are we communicating to our patients and our referring sources by the way we interact with them with our voicemail. This can help us as a practice. It can hurt us. So if you'd like a free evaluation, listen to your voicemail, make any recommendations. There's no obligation to have this evaluated, and it's something that we offer as a service, so you don't have to wonder if things are set up correctly for the practice. You can have this evaluated. So I want to thank you for your attendance today and for your support of the Academy. We're honored to have this many years relationship with the Academy and providing services to members as well. So again, I'm Ray Cool, and I thank you for your presence and your attendance today. We're finished. Hope everybody has a good day.